I would just add that we are being pushed, basically, into accepting risk by more and more payers. We have 3 Medicare Advantage contracts, and the other Medicare payers want us to accept risk. Initially, no downside risk, but definitely heading towards that. And we're also part of an ACO where risk is very important. And the information that we've been able to receive from working with SCIO not only tells us how many HCC codes, for example, are missing from patients, we're also given the RS, the risk factor per provider, and for the population of NEMG versus national benchmarks. All those make you see either you're doing really well or doing really poorly, and I'll say we were doing really poorly. And so it's instituted a whole educational process, chart audit process, and working with SCIO, we're really excited to see the benefits of working with SCIO and the results of what we're doing.
Donna, what do you think is driving the industry to need better analytics or visibility to risk adjustment within the populations that they are managing?
That's a really good question, Erica, and I think that CMS has publicly stated as they shift towards more value-based payment structures that they're shifting from being a payer of claims to being a purchaser of services, and that is outcomes-based. And so because of that shift and because of the way they're changing payment, it's really critical that they know how, are they spending their money right? Are they getting the right outcomes from the money that they're spending? And this is critical for any provider organization taking on risk, that they understand more about the population as well. They understand the outcomes. They have to deliver the outcomes. They understand the payments that they're receiving. And again, if those payments are driven by the documentation accuracy, they need to see if there's any gaps, if the way that they've documented the conditions for the population are off at all, if there's any gaps that are giving them an incomplete picture. So provider organizations are really hungry to be able to understand the entire population, understand how providers also are documenting and which providers are documenting on which patients. They need to see, as Bill was just mentioning, what are the documentation practices of all the providers in that population as well, because it provides in aggregate the risk not only for those patients, but in aggregate for that population, the benchmark, especially if they're in an ACO or an MSSP, it sets the benchmark for what they need to perform against. So they want more visibility from every aspect that they can to be able to better manage the population and predict their revenue streams and be able to budget for services accordingly.
I'll just add that CMS is really pushing this onto the insurers pushing it onto the providers. Mm-hmm. Even though this has started with Medicare Advantage, it's also affecting the ACO, and we see more and more commercial payers using some form of HCC coding in ascribing how we're doing as far as assessing risk factors, and eventually it's going to affect income. So the insurers need the income based on HCC codes, and they're pushing providers such as NEMG to really improve how we're, first of all, quantifying HCC codes, and second of all, just as importantly, as Donna alluded to, documenting HCC codes. And if we do a good job, the insurer makes money, and then in risk contracts, which we're heading toward on almost all payers, we will benefit as an organization.